Good morning, Chicago. I'm Dr. Allison Hourty, Commissioner at the Chicago Department of Public Health. Thanks so much for joining us. As always, almost 2 years in, this is your chance to get your COVID questions answered. Thank you for everybody who's continued to send in questions. We had a really good day yesterday with child vaccines getting going. Happy to answer additional questions about that, questions about boosters, really anything you have. You can put them directly into the box below on Facebook or Twitter. You can also use the hashtag AskDrArwity. So as always, let's start off with a look at our local data at chi.gov/COVID-. So if we take a look, we still are seeing a little bit of an uptick in our numbers. We're averaging 328 cases per day. You see that that is up 12% from a week ago. We're averaging 19 hospitalizations of Chicago residents every day. That's up from an average of 17 every day a week ago. We're averaging 3 deaths a day still. That's been relatively stable in the 3 to 4 range. You see we have hit 6,100 Chicagoans who have died from COVID. As a reminder, 99% of them unvaccinated. We're doing a lot of vaccine, which is great. 8,954 on average. Starting to get some kids in there, but a lot of these are boosters, and we're seeing plenty of people getting that first and second dose, which is great. Doing about 20,000 tests a day. You can see sort of over the whole pandemic, that's very good and high. In that setting, our positivity remains good. We like it under 2%, but it is up a little bit. It's 1.8%, up from 1.6% last week. So keeping a close eye on some of this. As a reminder, you can always click across here if you want to look in more detail about cases or hospitalizations or deaths. If you want to look by age, gender, race, ethnicity. You want to look by zip code. If you want to look at testing, vaccine, you can see 75.5% of the eligible population over 12 have gotten a first dose. We will be adding in 5 to 11-year-old information, likely starting next week after we've collected some data over the weekend. So probably on Tuesday, I'll have some data to share with you. If we look at the breakdown by age of vaccine, we're doing well. The 12 to 17-year-olds, almost 2/3, 66.2% have gotten a first dose, 58.1% are fully vaccinated, just about caught the 18 to 29-year-olds. And you can see still people in their 50s are the most vaccinated here in Chicago. You can look by gender, race, ethnicity, or by zip code. So let's pull up just a few slides here. Okay. So where we put our current data onto our community transmission and risk matrix, you see that 322 cases per day is in the substantial transmission range where we've been for the last few weeks. The positivity remains at the low risk, the low transmission range, and both hospital and ICU are still in that low risk, but all 4 metrics are increasing. Here's your weekly updates through last week of COVID case rates. So the red represents Chicago residents who are unvaccinated. The blue represents fully vaccinated Chicagoans. So these are the breakthrough cases. Breakthrough cases remain rare overall. Even if we just look during the Delta surge, unvaccinated Chicagoans have been more than twice as likely as vaccinated Chicagoans to be diagnosed with COVID. And then that separates even more as we compare hospitalizations and death. Just in the Delta surge alone, unvaccinated Chicagoans have been 5 times as likely as vaccinated Chicagoans to be hospitalized with COVID-19, and then 8 times as likely to die from COVID-19. Here's what the community map looks like for our vaccine coverage for residents 12 years and older. Remember, we're trying to get to 77% here. We're getting close. 75.5% as a city overall have gotten that first dose. In terms of milestones this week, that's those green circles. West Elsdon reached 80%. Both Calumet Heights and Garfield Ridge reached 70%. Fuller Park reached 60%. Greater Grand Crossing reached 50%. So good to see continued progress. We still have a ways to go in most of the city. So In terms of completed doses, that's where we're just under 70%. As a stretch goal, we'd like to see completed doses get to that 77%. The darkest blue you can see the relatively small number of community areas that have hit that 77% fully vaccinated. Just this one on the north side, I think that's North Center, some in just west of the Loop, and then down in the Southwest, really doing very, very well there from a vaccine standpoint. In terms of where we're seeing the most improvement in vaccination for people getting that first dose, this map looks exactly like I wanted to. We're seeing the most new doses, the most improvement in the parts of the city that are behind in terms of vaccine. And so last week, for example, Washington Park, circled there in green, had the biggest increase in first dose vaccine coverage. And every single day, like I say, there's thousands of people here in Chicago deciding today's the day to get that vaccine, get themselves protected, help protect everybody else. As a reminder, we've got some deadlines coming up here. If you want to be fully vaccinated against COVID for Thanksgiving, November 11th would be technically the day that you'd need that second dose or a single dose of J&J. For kids who are just becoming eligible, they won't be fully vaccinated, but you do start to get some protection. So if they can get their first dose, also in by the 11th, that'll be at least a start. For Hanukkah, you'd have to have your first dose of Moderna by the October 17, your first dose of Pfizer by October 24th, or your first dose of J&J by November 14th. Christmas, and we got lots of questions about this on Tuesday. There is time to get kids fully vaccinated in time for Christmas. So for kids, it would only be Pfizer. So you've got till November 20th to start vaccinating with Pfizer to have somebody fully vaccinated in time for Christmas. December 11th would be for J&J. And then you see for Kwanzaa, the similar date. So let us know if you have questions about this. Really excited that we're going to be able to gather in ways that was just not possible last year. That is because of vaccine first and foremost. So let us know if you have questions there. We do have vaccine events continuing to happen this weekend. You can go to chai.gov/COVIDvax if you want to see those details. We're at restaurants, churches, Swaparama, flea markets, etc. As you know, all children aged 5 to 11 are now eligible to receive Pfizer COVID-19 vaccines. They've already begun to arrive in Chicago. We'd gotten 28,000 doses in by the evening that the CDC approved it. And there's tens of thousands more arriving today, tomorrow. The pharmacies are largely starting over the weekend. So lots of opportunities. My team yesterday was watching this very closely. You could absolutely make an appointment at dozens of places around the city. So you can check pharmacies. First and foremost, check with your pediatric provider if you have one. All pediatric providers in the city have been offered the opportunity to receive COVID vaccines if they want to administer them. They may not all get it necessarily in the very first week if they are a smaller practice, but we will absolutely be sending vaccine to any pediatric or family practice office that wants it. The federally qualified health centers have all gotten it. Obviously, the school-based health centers and for all of the school outreach work have received vaccines. So you can go to chai.gov/youthvax if you want to see the child information specifically. Also, as always, chai.gov/COVIDvax will get you to the general COVID vaccine page. I promised I'd talk a little bit about some tips and tricks to help you and your younger child get through that needle stick. So there's a few things to do beforehand. You do want to talk to your child about getting the vaccine, and you want to be honest about that. If it's a younger child, you may not want to talk about it for days or weeks, ahead of having that appointment. You know your child best on that. If your child asks a question that you don't know how to answer, it's fine to say you don't know. You can ask when you get there. Try not to give them false ideas. Don't say you won't feel a thing. Don't, though, focus on pain. We know children worry about getting shots. If they ask if the vaccine will hurt, you should tell them the truth. I usually say things like, some kids say they can feel a small pinch and some pressure. You can let me know what you feel after it's done. If you've been vaccinated, I talk about, I really didn't feel it when it was going into my arm, but my arm was sore for about a day afterwards. Be honest about that. When you're actually at the appointment, as much as possible, it's good to have the child have some choice. Younger kids sometimes want to sit on the lap, for example, and they'll help you position the child, ask them, do they want to watch, do they want to look away, do you want the provider to count down from 3, that kind of thing, to just help them feel in control. And then afterwards, let them know specifically what they did well. You can say things like, you did it, I know you were really nervous about that, and then tell them it's normal to have a sore arm or potentially not feel well for a day or 2 afterwards. That means that the body's making ways to protect itself. It is good to keep moving. That's true for adults or kids. So you'll exercise that arm. You don't need to rest it. Sometimes you can put a cold washcloth if it's bothering an arm. You can also give over-the-counter pain medication, Tylenol, Motrin, ibuprofen, acetaminophen, etc. If your child can take those medications. And as a reminder, the Pfizer vaccine for children 5 to 11 is only 1/3 of the dose of what older teenagers and adults are getting, and so chances of side effects are lower, and most kids are having no significant complaints after getting the vaccine. So everything looks good, and we will continue to keep you updated. There's more information and flyers on our website, chi.gov/COVIDvax, if you want to see some more information. A lot of this was put together by local pediatricians and children's hospitals here in Chicago with some specific recommendations. So take a look at that if you're interested. And then the last thing is I just wanted to share that the City of Chicago is awarding some grants to small businesses and nonprofits that were financially impacted by COVID-19 as part of the Chi Biz Strong effort. So they're grants of between $5,000 and $10,000. They are prioritized for small businesses that had not otherwise received government financial assistance during the pandemic. That would also apply to nonprofits. So if you know an organization for whom that would apply, I encourage them to apply. The closes on November 12th, and you can go to chicago.gov/ChiBizStrongGrant to get more information. So please spread the word on that. Okay, so let's go ahead and get into your questions. All right, Anthony on Twitter says, can the city handle both boosters and vaccinating children at the same time? Considering the issues with vaccinating certain parts of the city, what is being done to reach out to parents in those neighborhoods? Yeah, great question. So definitely the city can handle both boosters and vaccinating children at the same time. I will tell you, at our mobile events and really the city sponsored events, we actually have stuck to just doing Pfizer and Johnson & Johnson. We don't administer the Moderna vaccine, not because it's not a great vaccine, but just to cut down, especially for mobile events, on the number of different kinds of vaccine or different dosing, et cetera, that we're using. So Johnson & Johnson, of course, is the one-shot vaccine. We still are seeing people choose to get that vaccine. Anybody who just wants to get one shot and be done, that's the one to get. Although we do encourage people, to get that booster after it, et cetera. But for any purposes, if there's a work requirement or even in clinic, if I see somebody really worried about side effects, et cetera, continue to recommend that J&J vaccine, and we see people choose it. For people who want an mRNA vaccine, we do adult doses. We will have child doses. We are starting our larger events for pediatric COVID vaccine, not this weekend, but next weekend. And we'll be running Saturday and Sunday at all of the, at the city colleges around the city. Basically Saturday and Sunday, Saturday and Sunday, Saturday and Sunday, likely into January, except for the weekend of Thanksgiving. So if you go to chi.gov/youthvax, you'll see the schedule for that, and we'll be signing folks up there. In terms of some of the outreach, so a lot is happening for parents in those neighborhoods. We really are using a lot of focus on school and ensuring that for the parents and the guardians of school-age kids, they obviously are connected to their child's school. It's a place that they're used to getting information. There are often requirements that they're coming in for report card pickup, that there's opportunities to engage with parents and guardians. And we've been working closely with CPS and with other schools across the city to really plan vaccine education, vaccine confidence, vaccine access, specifically around schools. And our work continues with churches, trusted messengers, et cetera. I had the honor of being down at Salem Baptist Church Salem Baptist last evening down in Roseland, where Pastor Meeks does a weekly streamed conversation. And we've really appreciated the way so many faith leaders across Chicago have stepped up to educate their congregations, to really be supportive of vaccine, of the science. And actually this Saturday, for those who aren't aware, there's a day of prayer across the city of Chicago from 11 to 12 with a focus on those faith communities. So in all 77 community areas, on some street corners, there's a lot happening, really with a focus again on the important work that faith community has been doing in this space to support Chicagoans, to answer questions for Chicagoans, and to help with really very physical needs that Chicagoans have had, whether that's the food and the mental health and the outreach, whether that's vaccine access, testing, et cetera. It's been such a critical role. There's going to be an initiative called. It's not called "I Want to Hold Your Hand." That's what the song is. I think it's "I'll Hold Your Hand." That is really again meant for religious groups or those of faith who not only are interested in getting vaccinated themselves, but helping others in their circles get vaccinated. And so there's a vaccine ambassador course that's available online. We're doing, again, some specific outreach through faith communities, and then where there are people who want some support in getting vaccinated, it's part of an outreach there. So between sort of some of the schools and some of the religious settings, we're also continuing to do very well actually with food pantries and some of the flea markets, swaparamas, those sorts of settings continue to be really very good settings for us for vaccine outreach. We've got a big senior push still going on. We're at senior centers doing things with Housing Authority, lots of work very much still going on. And so I really see the opportunity to talk about vaccinating children also as an opportunity to reintroduce that conversation for their parents, guardians, aunts, uncles who may not have been vaccinated. And so that's part of how we're thinking about it. John Special from Facebook, how long after you receive the booster before you get full benefit? Is it 2 weeks again? Yeah, broadly. It's kind of like the first time around, you start to get some protection right away, but I'd say 2 weeks after would be when that would peak. And so if you're interested in being fully vaccinated for Thanksgiving, be getting that booster in the next week or so in terms of being at that highest level of protection. Some people have been asking, should I be trying to time my booster around a vacation, an event? I really don't think that is not the way I am thinking about it. I got the booster and am comfortable in the level of protection that I have. I'm comfortable with being able to travel for the holidays. I'm comfortable with being at very low risk of acquiring COVID, spreading COVID, et cetera. Becca Wood asking, what does Biden's vaccine requirement mean for Chicago? She's on Facebook. So there's news coming out about this today. And basically this is through OSHA. So it's the Health and Safety Administration. And it's this requirement that in businesses that have at least 100 individuals, there's either a vaccination or a testing requirement. Lots more detail is going to be coming out about that. But yes, this was announced probably a month ago, and the details are starting to come out now. My understanding is that will need to be in place by January 4th. And obviously for the city of Chicago, that matches well with our timeline of having more than 30,000 employees, but having been working a lot on our own vaccine policies for employees. And there are lots and lots and lots of businesses here in Chicago that have already made decisions around vaccine or vaccine and testing for their employees. So when there's some more details that come out here, we'll probably put together some more individual information, especially for business owners who may be wondering about this. So yeah, I'm watching that with interest. Thanks for the question. Becca Wood is also asking, I've been seeing a lot on neurological issues like memory loss stemming from COVID. Has there been new research on this? Are there signs people should take note of? Thanks. So this is related to the long COVID issue. In the same way that we've seen people sometimes take a long time to recover their sense of taste or smell, or it can take a long time, even after they've recovered from the acute phase of COVID, to feel like they've gotten their energy back. There definitely are people who, after recovering from COVID, in terms of, they're no longer having fevers, if they were seriously ill, they're out of the hospital, but sometimes for weeks and even months, people are reporting these longer standing chronic health issues. So there's a number of studies that are going on, and including some here in Chicago, that are following up on people who have had COVID and are having long COVID symptoms or are not, to try to understand some of those differences. I think some of them are actually going to be enrolling some more people shortly. So if you have interest, we'll share some of that if you are someone who is interested in helping to learn some more about it. The smell and taste was one of the most unusual things about this virus as we were first learning about it. That is not something that is associated generally with other viruses, and it's turned out to be what we call pathognomonic. It's pretty specific that if somebody's having that, there's a good chance that they're infected with COVID. And still learning about some of the neurological systems, sort of what's making that happen. So I don't have any major update for you there, but I'll pull for you, and next time we can share a little bit about what is known. Really, it's going to be these longer cohort studies doing the comparisons between people who have had the longer effects from COVID and those who have not, to probably understand it. Okay. So question here, activist mama on Twitter says, not the Hunger Games, Dr. Arity? Here's a line down the street of kids competing for appointments for the vaccine. So I would really, I love seeing kids getting vaccinated here. I'm not quite sure where this is, but like I said, there are lots and lots of appointments available for vaccines. So yesterday alone, I was on there pretending I had a 6-year-old to sign up, and there was availability absolutely all over this city in a lot of settings. Not necessarily the first day. So I'm guessing if this was a picture taken, yesterday afternoon in the very first moment, these are some of the most anticipated folks. But there's plenty of vaccine here. More than 28,000 doses already here before we started vaccinating. 99,000 scheduled to arrive in the first week alone. And we only have 210,000 Chicagoans between the ages of 5 and 11. So not concerned about that. I would encourage you to make an appointment. If you make an appointment, you don't have to wait in line. And there's plenty of appointments. Okay. So Lee Mabry White on Facebook says, why can other school systems offer vaccines in schools? What's wrong here in Chicago? Not enough doctors. So I'm not sure where this keeps, I don't know why, it's just interesting. Like, something must not be very clear here. We were on Tuesday with Pedro Martinez from the new CEO of CPS, and school systems absolutely are offering vaccines in schools. I'm not sure where people are getting the sense that that's not happening. In CPS specifically, just to walk through that high level, first of all, they have 4 large regional sites across the city, high schools that are open, have been open the whole time, can walk in, et cetera. They also have about 16 scattered school-based health clinics that are based in schools that are vaccinating. But in addition, they've been signing schools up for that, like, specific come to vaccinate kids and parents, whoever, at that school, within the school setting. And there were, when he was here on Friday, there were 83 of those schools already scheduled just in the next, month or month and a half. So there are definitely a lot of, there's a ton of planning and a ton of availability, and I expect that to be sort of our longer term plan too, after we get through this first bolus of people who are really excited to get their children vaccinated. I expect schools will absolutely continue to be part of that. So I hope that helps clarify it. You're not the only person to ask that, so I think there is just some confusion on that point. But trust me, there's lots of planning happening to make sure that not just kids, but their parents and guardians are able to access vaccine at the school setting. Okay, so Maggie K9 from Facebook says, comparing vaccinated people who get COVID versus unvaccinated people who get COVID, can you talk about viral loads, duration of illness, and transmission rates? Yeah. So this has to do with the difference between sort of a breakthrough infection versus someone who has never been vaccinated and gets COVID. So what we've seen, there's been a lot of studies on this, is that first of all, people who are vaccinated are much less likely to get COVID to start with. And you cannot spread COVID if you do not get COVID. So you probably know that, but it's something that I find myself explaining a fair bit. So the most important thing is that getting vaccinated protects you from getting COVID. When you don't get COVID, you cannot spread COVID, okay? So there is no possibility of getting the vaccine and somehow spreading it from getting the vaccine. So when people do get COVID in a breakthrough infection, the main thing is their duration of illness, meaning the amount of time in which they can potentially transmit vaccine is much less, and their chance of transmitting is also much lower. So this is one of the things that there's been more and more research about coming out over the summer, and it continues to be reassuring in that regard. There was just a study out of CDC like maybe a week and a half ago that was again comparing the difference between vaccinated and unvaccinated people, like those red and blue bars that we show every week, that not just here but across the city we continue to see those differences. And so it is true, and then people tend to, one of the main questions I get is, why should I get vaccinated when I could still get COVID? You could still get COVID, but it's the number one thing that you can do to decrease that risk of getting COVID. There's never been a vaccine that's 100% protective, but where we've got these vaccines that are in the 80-90% protective, especially if they're boosted, kids 95, that is by far the most important thing for not just the person in terms of not getting COVID, but also limiting the spread of COVID, because remember, you can't spread COVID if you don't get COVID. Okay. So, Gray Bomb from Twitter is asking, why don't you respond to questions about mental health and masking kids? Are you unaware of what's going on? So go back and look on October 21. We did a whole hour with Matt Richards, who is our Deputy Commissioner for Behavioral Health at CDPH. We talked about mental health in detail. We talked about masks. No evidence that masking children harms their mental health, period. Okay, a number of you are writing in wondering how much I get paid from Pfizer or to push vaccine. I get paid exactly $0. $0. It does not make one bit of difference to me financially. I don't get a bonus if I work more hours, because I work a lot more hours. I don't get a bonus from a pharmaceutical company. I don't get paid based on how vaccinated the city of Chicago gets. CDPH does not get money depending how many people get vaccinated. There is no financial incentive for us to push vaccine. In fact, it is an extraordinarily expensive operation for the health department. Luckily, we've gotten federal funding that can support that. But you know, people who think that we are benefiting financially in some way from getting people the right information about vaccine, that is absolutely false. So I would ask you to do some more reading on that from reputable sources. I don't know where you're getting that idea, but it is not based in truth. Okay. Melanie Taylor on Facebook. Will the mass vax clinics be in time for kids to be fully vaccinated by Christmas? Yes. And if by the mass vax clinics you mean the large clinics that we're going to be having Saturdays and Sundays, you know, starting next weekend, the weekend of the 14th, and then going into January, except the weekend of Thanksgiving, there will be time there for kids to get fully vaxxed by Christmas. You can find those dates if you go to chai.gov/youthvax. Lots of details there. Kathy Powers from Facebook, can the parents be vaccinated with the children at schools? Yes. All of those schools, at least through CPS, are set up specifically to vaccinate members of that school community, which absolutely includes parents and guardians. The biggest risk by far for transmission is in the household, always. So it is in the best interest of schools, who of course want to limit COVID transmission and COVID risk, to ensure that not just the child attending school, but the people in their households are vaccinated. Okay. Don Wolf is asking, what are your concerns about the holidays? Travel, especially to border states, kids of varying vaccination status. I'm guessing many family gatherings will include both vaxxed and unvaxxed guests, and no one will wear a mask. Do you expect a surge? So I don't know for sure what the next couple of months will hold. I think we would be very lucky to not see an increase in COVID, because it's just gotten cold here. People have moved inside much more. And this is the time of year when that happens that we typically see respiratory viruses spread most easily. It's why flu season doesn't happen in the middle of July. It's why, you know, that cold season and other respiratory infection season really tends to be more often this time of year. COVID has not always behaved in a seasonal way, partly because as a novel virus, it had so much ability to spread that we weren't maybe seeing some of those same seasonal patterns. And it's been very clear that you can have huge outbreaks when it's hot, when it's cold, etc. But there is increasingly some theory that as the weather, you know, is changing, we're potentially going to see this settle into some more of a seasonal pattern. I don't know for sure. I do know that across most of the southern U.S., where in the middle of summer it's very hot and people tend to move inside to get air conditioning, is when they were seeing big surges. And then up in the north, especially north of us, as things have gotten cold, we've started to see numbers go up there. There's a lot that goes into COVID. I've talked a lot about this. There's the host, meaning the activities we're taking, our levels of immunity, our mask wearing, our behaviors. You know, there's the virus, how it continues to mutate, new variants that emerge, how well it can last, you know, in different settings. And then there's the environment itself. And all of these clearly have an impact. So when I think about the holidays, I am nowhere near as worried as I was last year. In fact, I'm very confident that holiday gathering for most people is going to be really safe and appropriate. I will tell you that, you know, any family gathering that I'm attending is only going to have people who are fully vaxxed unless they're not age eligible. That is just sort of a decision that I make. But you're right that there are probably some families that will have that combination. And we may see some more additional cases around holidays. We certainly have seen it before, but I'm not worried about the major impact like we were seeing last year, simply because we have a lot of people vaccinated. So I think travel, if you're fully vaccinated, boosted if appropriate. I'm planning to travel. I'm not very worried about it over the holidays. And I think if kids are getting, that's good. All right. Melanie Taylor on Facebook is saying, The appointment that I got for my 11 and 8-year-old yesterday, yay, they feel like superheroes. Good job, first day. It was about 45 minutes away. Lots of closer places didn't have their vial shipments in yet, like Walgreens, for example. All of theirs are actually arriving today. She says, since there will be more availability closer when their second dose is due, can I take them to a vax facility closer to home, or should I take them back to where they got their first dose? Great question. You can bring them closer to home, not a problem. It all goes into the same secure vaccine registry, and you'll have your card. You can bring that back. So you do not have to go to the same place to get the booster dose. Or not the booster dose, the second dose. And congrats on getting your kids vaccinated already on that first day. Okay. We are coming up on time here. I'm just trying to see if there's anything. So there's a question, is there a location or website that lists the clinics that have Pfizer doses readily available for 5 to 11-year-olds? So on chi.gov/youthvax, you will see information about the various settings where it's available. I encourage you first and foremost to check with your own clinic, your own pediatrician. Like I said, all of them have had the opportunity to order vaccine if they want to get it, and that's really where I would start. Other than that, the children's hospitals, many of them, not just the children's hospitals, but some of the regular hospitals too, are offering special vaccine clinics, especially on the weekends. And you can go to vaccines.gov, like the big overall vaccines.gov website, that the feds are actually linking up the vaccine shipments to that finder. The 5 to 11-year-old at the federal level was still not live when I looked at it this morning, but I expect it probably will be in the next day or two as more of these shipments are out. And that will also be a centralized place where you'll be able to see where vaccine has been shipped and when and where it's available. So in the meantime, though, the pharmacies across Chicago are letting you make appointments. The clinics are letting you make appointments, and there are many places that are already vaccinating and or getting started in the next day or two. Okay, so I think we are just about at time. There's one more here. Damien's asking, when will the booster shot be available for homebound patients? The booster shot is available now for homebound patients. 312-746-4835. That's always your number if you've got a question about vaccine here in Chicago. If you're looking for an at-home appointment, if you want to know where to get a booster, if you're curious about children, whatever your question is, 312-746-4835. And yes, we have been making booster appointments for people who are homebound. I do want to remind you that people who get a booster, though, are not eligible for an incentive, just to be clear about that. So incentives are for people getting their first and their second doses. And just as a very last one, Paloma Blanca on Facebook is asking, is a J&J booster approved? Yes, it is. Moderna, Pfizer, and J&J have all had boosters authorized by the FDA. And again, on chi.gov/COVIDVax, there's some more detailed information if you want to look at timeframes and recommendations. Thank you all so much for tuning in and asking good questions. We will be back next Tuesday. I expect by then we'll have some data about 5 to 11-year-olds, and we'll get into some more of kind of the steps that are next and go from there. So thank you all, and have a lovely weekend. Stay warm, and for those of you getting your kids vaccinated, congrats. Keep spreading the word. Appreciate it. Bye-bye.